Now we're running short on time, although I suppose that serves as a fair metaphor for the very problem that we're all trying to combat. So perhaps that's fitting enough. But I think it would be reasonable to have a short panel discussion. For any speakers that are still able or willing to join us in that, please feel free to jump in, turn on your mics and your videos. Um, and yeah, we'll have maybe a 10 or 15-minute discussion. I think it makes sense to start with a question to all attendees. It goes without saying that a greater degree of resource optimization and synergetic collaboration within the longevity industry ecosystem, both from an academic or an industry standpoint, would do some good in terms of accelerating the actual socioeconomic dividends that we're all fighting for. I'm wondering what our various panelists consider to be among the largest bottlenecks for a greater degree of collaboration among industry stakeholders and participants. So if anybody has thoughts on that matter, feel free to jump in.
I would like to just say that there is a divide between the aging community and the longevity community. And I think that's one of the issues. The biggest voices, and that's not just true in the US, are gerontologists, social workers, people who are policymakers, nonprofits that are there to support the disabled aging. And what I mean by that is almost everybody over the age of 65 is looked at as a patient or in need or having entitlement issues, food insecurity. These are very, very important things. But they have created an ecosystem of their own that does not look at aging as something that can be intervened in, but as inevitable. And all of their money and all of their thinking and their leadership is toward making it easier to take on and live with these comorbidities one way or another. And we really haven't made that coalition. We've made a big coalition between different kinds of geroscience and the medical professions, even policymakers and insurance and payers, but not between the longevity community and the aging community. They have not met. And unless we're really going to change people's ideas about what's important with regard to aging into the ability to intervene in it, we're going to need that coalition. At least that's here in the US. But I've been seeing it also in my work with the United Nations, that they have a mission that sounds exactly like ours about equality in health span. That's what they call it, the moonshot, so do we, of health span equality. But what they're talking about is older people in great need and how to meet their needs, not intervention in increased health span and healthy aging for all. So if we can get that message out, we can meet those people, we're making a very big difference, I think, is missing. So that's what I think is one of the challenges, aging versus longevity or health span.
Yep, I couldn't agree more, Adrian. We're big believers. I assume broadly, but certainly at Aging Analytics Agency, of the power of an actionable definition, and the fact that defining the issue and framing it in the proper way to allow for actionable progress towards a given goal is very important. I know that Catalyst and Connexum believe that very much as well. With your Metabesity conference, Zan having coined the term Metabesity, as well as your 12 challenges framework. So yeah, I couldn't agree more. Both with that, the power of the definition and the need to transition from, let's call it age-friendly to longevity-friendly. Indeed. Anybody else have any thoughts on the matter of bottlenecks? Ilya?
Yes, thank you. I think what we need is more internationalization. The longevity field is still largely US-centric. We need to access vast amounts of talent that is not accessed in other places, and not necessarily in the so-called West or developed countries, but also in the developing and low-income countries. Also, in terms of basic education, we need more materials in native languages, and not except apart from English. In addition to English, we need to involve more people from Latin America, from Africa, from Southeast Asia. This way, we can really grow the community, the field. and achieve more synergy. That's also what the ILA works towards.
Yeah, I couldn't agree more, and I would assume that Ian Inkster would second that, given that international is half the name of the platform. Jose, did you have something to add?
Yes, of course. I totally agree. As I mentioned, Spanish has more native speakers than English. And I also try to emphasize that we have great scientists in Spain, and not only in Spain, in the USA, Spanish in the USA, and Mexicans and Argentinians and Brazilians. So this has to be a global community. And one thing that I miss here is no one from China. And China is doing incredible research on anti-aging. Actually, the government of China is publishing my book in China, the government of China, because they are going through a demographic implosion. China is worried that they will lose 700 million people, twice the US population, by the end of the century. This has never happened in history. Losing 700 million people, half of the Chinese population will disappear if the trend continues. So they have an aggressive program to have more people, or to not let people die anymore. And they are publishing my book. I'm really excited, but no one from China here. How can China not be connected here? At least we have people from Brazil and from Spain and Latin America, but we need China, we need India.
Yes, it's true. And speaking more broadly, we're aware of lots of things that are going on in Asia, as a continent. And you're right, it definitely needs a little bit more representation.
Frank, I believe that half year ago, Aging Clinics Agency actually produced Longevity.International special case study.
Yes, we did, and that's open access, available for all interested readers, attendees, etc. At Aging
And was China also included there?
It was, yes.
Okay, excellent. So, Ian, I hope that indeed, according to recommendation of Jose, you will ensure that next time on a similar meeting, there will be people from India, from China. I think there are also apparently should be Japan, South Korea, Singapore, countries. Hong Kong is the country with highest life expectancy. Singapore, the country with highest healthy life expectancy. So those two particular smart cities, countries, they should be apparently represented here. And by the way, regarding technology which Aging Clinics is using, because the AI system which is aggregating this information about several tens of thousands of companies and investors and organizations, so it's yet using English language for parsing, whereas on the next stage they will start to use probably Chinese and Japanese, and that will give capabilities to aggregate more information from those countries. In information about in the sense that industry players, industry stakeholders, companies, different scientists, and so on, so forth.
Yes, thank you, Dimitri. And I know that a big driving factor that unites a lot of your thoughts on different topics is the power of maximally modern technologies to facilitate progress, and the fact that certain stakeholders, areas, different silos of the industry ecosystem are, let's say, outdated and not using the full suite of modern technologies that they actually could be, repurposed from different sectors, etc. So a great time point indeed.
And I think that the mission, and I would say even the motto of this organization, Longevity.International, is to ensure that knowledge and information are distributed really internationally, and even not in a fair way, as Ilya Standard suggested, also towards developing countries, because that it's quite complex to extend healthy period of life, for example, old people in the United States, because it will require enormous budgets and efforts. But we both, with Ilya from Moldova, and in Moldova, it's the poorest country in Europe, and we've lost life expectancy even more. After break of USSR, the life expectancy, it's probably the only one country in the world where life expectancy actually decreased. So this is like absolutely unthinkable in modern days. But my point is that for such countries as Moldova, smaller, poor countries, it's quite simple to actually extend healthy period of life for people because it do not require any kind of, with just small budget or small efforts, applying some modern technologies for, let's say, diagnosis of simple pathologies. So you can actually provide significant positive impact in the sense that in underdeveloped countries with, just a small quantity of resources, you can do quite a lot. Whereas for such countries as UK or Japan, the United States, to make impact on national scale, the resources which are required, they're kind of enormous.
Yes, and I suppose that constitutes the inherent advantage for small countries, microstates, et cetera, in terms of longevity policy execution, which is something that I know you touch upon in your other forthcoming book, Longevity Politics. Yes, well said. Robert, did you want to add something?
Yes, I did. In fact, I just wanted to say basically two things. I think that there needs to be a greater connection of funding with vision and breakthroughs. And I'm going to say this, the Gerontology Research Group website, we founded it in 1995 with Dr. L. Stephen Coles. It's way past time. We need some funding for this to upgrade. I think a more inspirational updated website that would show, interactive graphics such as the world global scale of supercentenarians, a continent scale, and then national scale, and then data down to the local level. And secondly, there's been major breakthroughs in the supercentenarian research field that have not been followed up on. For example, the 115-year-old woman study that came out in 2014 in the Netherlands, there's been no follow-up on that. So this woman had almost no stem cell lines active at age 115. What's the problem there? We can't really say with just one study of one person if that's applicable across the large scale, but this could be a major breakthrough if we can get follow-up studies done. Also, the amyloidosis study with Dr. Coles was done in 2012, 9 years, no follow-up. This was a major breakthrough, and yet there's been no follow-up in 9 years. So these two areas, 9 years and 7 years, no major follow-ups. I think that if we have a better graphic display and more funding for our work, that maybe it'll attract more attention and there'll be more notice on that. And I do believe that we can, when we saw that study that came out that showed that the functional maximum human lifespan should be at least 135, even if you don't defeat aging. Think about that. We still have another 10, 15 years to add with curing non-aging. But I agree with others that when we have the big breakthrough with aging, the Methuselah Mouse Project in 2003 offered a prize for the first mus musculus to reach age 5. Guess what? It has still not happened. I think the record was 4.98 years. It's been 18 years. No one has been able to get mus musculus stage 5. This is something, and some of the people in the gerontology research group were telling me that one of the reasons it hasn't happened is that there wasn't funding for follow-up for the mouse life extension efforts. So that's just another area where people had great ideas and vision. Where's the funding? Where's the follow-up studies?
Thank you, Robert. The hourglass is getting a bit thinner, but for those that haven't jumped in yet, Johnny, Chris, Thomas, San, Joseph, Milan, Alexander, Layla, any particular thoughts in terms of critical bottlenecks for more synergetic, actionable collaboration?
I just want to give you a quick hint. In terms of Dimitri's and everybody's, Ilya's suggestion that this information gets to smaller countries. At the UN, it's Argentina that is the major player when it comes to issues of aging and policy in the United Nations. Now, they get their information to many smaller countries, African nations, Indo-nations, and so on. So if we can, and it's easy, I've been to Argentina, I met with the Minister of Aging, brand new elect, very open, looking for information. So if you want to get them on board, they then become the filter. They're not a small nation, Argentina, but they get the filter to all the small nations through the United Nations system and the NGOs on aging. So that's just a practical suggestion.
Well, thank you, Adrian. Yeah, that's a great practical suggestion and also representative of the fact that, effective strategy needs to work within the tiers, the filters, and the existing systems that we have, to work, playing to the strengths of the existing, let's call it, policy infrastructure that's already in place. Thomas, I see you unmuted yourself. Is there something you wanted to add?
Well, I didn't want to pat ourselves on the back, but it's kind of a Panglossian comment that when you have a platform and a forum like this, then many new things become possible or occur to folks. So I think that we all met people with interesting comments that were made in the chat room and so forth. So our ability to further make more synaptic connections, shall we say, is going to help with the collaborations. And one of the potential limiting aspects before was the fact that we didn't know each other, and we still don't, but we're doing our part to try to weave together a network of what I consider to be co-members in the Healthy Longevity Tribe. We're on a movement, a mission, and the ability to see each other face to face and see exchange ideas, I think will go a long way toward addressing some of those bottlenecks in the past. Not to say there aren't other bottlenecks to be overcome, but just wanted to give a shout out for this kind of an initiative.
Yeah, well, thank you, Thomas. I couldn't agree more. And the raw power of connections and collaborations. And hey, you know what? I consider some of the strongest friendships that I have to this day made through efforts within this fight that we're all involved in, which is transforming the challenge of aging into the opportunity of longevity. So we can have fun along the way as well. We probably have time for just one more. Leila, you want to add something?
First, this is an amazing forum, and I agree. I think we'll do so many things together. And actually, my suggestion is that maybe in this network, we can not only present what we did, but what we are doing or we wish we were doing. So this is an amazing way that we can connect and maybe help each other, because longevity is a new topic around the world. So we will only make a change together.
Thank you, Leila. Very, very well said. And I suppose it's worth mentioning very briefly, and Ian Inkster can reiterate this, that the scope of actual networking tools that's present on the platform is planned to be expanded significantly over the coming months to achieve at least an equal scope of functionality and comprehensivity as the informational or analytical resources that are present there. I think that about covers it. I wish we had more time to have an extended panel discussion, especially with so many great thought leaders in the room. But it was great fun and very enjoyable having you all here. And I'd like to thank you once again for participating, both as speakers and as representatives of your various institutions, for coming on board to support this platform's mission. It's very much appreciated. Ian, do you want to?
Yes, I'd like to offer thanks to all our institutional co-founders, including those that couldn't make it, for helping us to launch what we hope will be an acceleration hub of industry knowledge and networking and collaboration, and for joining us in the mission to provide actionable tools and resources and technologies to improve cooperation within the industry and accelerate the delivery of the dividends, the humanitarian and the socioeconomic dividends which we've worked so hard to make possible.
Well said, Ian. Also, a final thank you to all of our attendees. None of this is possible without you. So thank you so much for joining us today. This event is being recorded, and the full suite of conference talks will be available as recordings for post viewing in the coming days. I will ensure that Those are distributed among all of the attendees and registrants of today in due course. And also a quick reminder that Aging Analytics Agency is hosting a virtual conference on the topic of biomarkers of aging and longevity next Wednesday, starting at 5 p.m. BST. Everyone who attended today is very encouraged to join us there. And further details in terms of the agenda, link to join, etc., will be distributed amongst today's registrants and available on the Aging Analytics website in a day or two. Ian, anything else?
Oh yeah, just a reminder, everyone who tuned in, in order to subscribe to further events and updates and announcements, visit the www.longevity.international and click the login button at the top right of the homepage and register a free profile on the platform, and that will give you access to the full scope of the platform's resources and networking tools, which are going to be expanded. It's just a second.
Well, thank you once again, one and all, for joining us today, and we very much hope to see you again soon.
Thank you for the organization. Great event, great initiative. Thanks.
Live long and prosper, my friends.
Thank you.
Thank you. Bye-bye.
Bye-bye.